and we're here on KPVM with Eye on Cancer. And just a reminder, this is not a live broadcast. You can't call in with your questions, but you can get your questions recorded and we will answer them if you call to 727-9400, or you can email eoc@kpvm.tv. That's for Eye on Cancer, eoc@kpvm.tv. And we welcome your questions. They're very valuable. The questions that people are asking.
Yeah, they represent the the more common ones out there. So.
Yes, and I feel very privileged to be able to help get the answers out there. And we have a question about lung cancer. The question is, my doctor says that there are 2 types of lung cancer. What are they? Do you have an answer for that?
Yes, the commonly we refer to the 2 types of lung cancer. About 70% of the cancers, or say 2/3 of the cancers, will be called non-small cell. And for the lack of better terminology, and the other 1/3 is called small cell. And their names are, when you take a biopsy and look under the microscope, the small cell cancers look smaller than the other ones. So that's the terminology. They're treated a little bit differently with different prognosis. Also, among the category of non-small cell, there are 3 or 4 subcategories that we have discovered. So essentially, lung cancer now is more than just 2 types. And what we are finding out increasingly is that within those types, there are genetic indicators or markers, not of the person, but of the cancer. So these are what the genetic makeup of the cancer that will determine, because lung cancer patients with the same kind of lung cancer, how we traditionally define it as non-small cell or small cell, do very differently with the same treatments. So then that poses the question, what's different in either the patient or the cancer? And now we are finding that within the non-small cell category, there's a subgroup called adenocarcinomas. And they have certain markers. The tumor will have certain markers that we have targeted medication that will go and hit that target and is going to be effective for the patient. So typically they will decrease the burden of the tumor with the traditional IV type chemotherapy for a few months, and then switch them over to these pills. And if it hits the tumor right, that can make a meaningful difference in the quality as well as the quantity of life for the patient.
Aha. So huge strides toward making things work better.
Absolutely. We like them because, it takes the whole burden of the IV type treatments and the hair loss. And the pills have their new other side effects, which we are dealing with as they come. Mm-hmm. But it's much easier for someone to take a pill at home.
Yes.
And, as long as it's controlled.
Yeah, some of my friends have, in fact, my mom, way back when, they one of the times that she experienced cancer, she had the pill. And there is not the hair loss. Mm-hmm. And mm-hmm. So that's for us ladies, that's kind of good. So, and along with the previous discussions we had about self-exam and or early diagnosis, a new question is, how can lung cancer be detected?
The lung cancer, there's not a universally acceptable screening, but now there has been some talk about, and it's going to come in the guidelines to do for high-risk groups. That is going to be, smokers who have accumulated a certain number of smoking years. to screen them with low-dose CT scans. So those, we hope, will detect the cancers early enough that we can then do something about and increase the cure rates. In general, the signs can be cough, it can be blood in the sputum, chest discomfort. All those things need to be brought to the primary care doctor. Every cough will not mean cancer. Every time you have a little blood in the sputum, it could be just an infection. So that needs to be brought in to your regular doctor, and then they will order appropriate testing. Typically, the CT scan or the CAT scans are much more sensitive than traditional X-rays if we are concerned about a malignancy.
So the difference between the traditional X-ray and the CT scan then is the X-ray is a negative type photograph? Is that?
Yes, I mean, it's just the resolution of it. It's a different test. It's like looking at a faded film from the 1960s versus doing your 15 megapixel picture.
Oh, okay.
So you can pick up things that are much more smaller.
Okay.
Yeah, X-rays are okay to follow up on, say, if you have an infection or fluid on the lung. But if you're talking about smaller lung nodules or lymph nodes, X-rays are not very good for that.
Uh-huh. Okay, and I hope I'm not overdoing it, but one more time, if you could share the breast cancer information, because like we said earlier, it's local and easy to get to and might save some lives.
Absolutely.
Absolutely.
Happy to do it. So the address for the Susan G. Komen Foundation is 1981 East Calvada Boulevard. Telephone number 775-751-7095. And the other one is Women's Health Connection. That's 877-385-2345 or 702-489-3434.
Very good information. This cannot stress enough. Women's health groups, cancer support groups in general, and if you have any indication that something is wrong, talk to people and talk to your doctors.
Absolutely. And I think the first stop should be your primary care doctor.
Mm-hmm. And how much interaction do you have with the primary care doctors?
You have to. I mean, for our cancer patients?
Yes.
All the time.
All the time.
Yeah.
So you're cross-referencing for blood tests and that type of thing. So, well, one more time, we are not a live broadcast, but you can get your questions answered at 727-9400. You can leave your questions so that we can answer them. And you can email eoc@kpvm.tv. Doctor, thank you again for another week of valuable information.
Happy to be here.
Thank you so much.
Happy to help. Thank you, Linda.
Come back.